All right, let's get right into it. In the next few minutes, we're going to walk through the exact steps for responding to a cardiorespiratory emergency. Think of this as your visual guide to not only pass your practical exam, but, more importantly, to act with real confidence when it truly matters. Let's begin.
So, here's our game plan. We're going to cover the complete emergency roadmap, from that very first check all the way to the final care you'll provide. This is the exact sequence you've got to know, so let's break it down step by step.
Okay, first up, we need a mental framework that's going to guide every single action you take. That is CLA, which stands for comprobar, llamar, atender. Or, in English, check, call, care. This simple plan is your best friend under pressure. It's the key to staying calm and doing the right thing.
Yeah, it's that simple. This is your entire emergency plan in 3 letters. First, you check the scene and the person. Then, you call for professional help. And finally, you attend, you provide care. You need to memorize this. This sequence is the foundation for absolutely everything that follows. So, let's dive into that first step, check. Before you do anything else, and I mean anything, your absolute #1 priority is checking that the scene is safe for you.
Before you even think about rushing in, you have to take a crucial second to scan your surroundings. Are you near traffic? Is there a fire? Any dangerous objects, downed power lines, spilled liquids, anything at all that could put you in danger? Remember this, you can't help anyone if you become a victim yourself. Your safety comes first, always. Once you've confirmed the scene is safe, then you can approach the person. You'll want to tap their shoulders firmly and ask loudly and clearly, "Are you okay?" If you get no response at all, no movement, no sound, nothing, you have to assume they're unconscious. The second you realize they're not responding, your next move is crystal clear. It is time to call for professional help.
When you call 112, be ready to give them this key information clearly. Tell them who you are, what happened, your exact location. That's critical. The person's condition, meaning they're unconscious, and let them know you're about to check for breathing and might start CPR. This gets the right help on the way fast. Okay, with help on the way, your focus snaps right back to the victim. The next critical question you absolutely need to answer is, are they breathing?
And you're only going to do this for about 10 seconds, no more. You're going to use 3 of your senses. First, do the head tilt to open their airway. Then, get your cheek down close to their mouth. You're going to look to see if their chest rises, feel for any breath against your skin, and listen for the actual sound of breathing.
Now this image here shows you exactly why that head tilt is so vital. When someone is unconscious, their tongue can relax and just fall back, completely blocking the airway. This simple action lifts the tongue and clears the path for air. It's a small detail that makes a massive difference, and it might be the most important thing you do. Okay, so this is the moment of truth. This is the big decision point. You've checked the scene, you've called for help, and you've just confirmed the person is unconscious and they are not breathing. This is the pivot point where your next action could save a life. So what do? The answer is clear. You begin CPR immediately. This is the most critical thing you can possibly do while waiting for that ambulance.
So what are we really doing with CPR? Well, we're essentially becoming the heart. Their heart has stopped, so we are manually taking over its job. Every single compression pushes oxygen-rich blood through the body, keeping the brain and other organs alive until professional help can get there.
Proper technique here is everything. Place the heel of one hand in the center of the chest with your other hand right on top. Keep your arms totally straight, lock your elbows, and use your body weight to push down. The cycle is 30 compressions, then 2 rescue breaths. But listen, if you aren't trained or you're not comfortable giving breaths, just focus on continuous, high-quality compressions. The single most important number to remember in CPR is this one: 100 to 120 compressions per minute. It's a fast pace for sure, but that's what's needed to keep blood moving effectively through the body.
So how do you remember that rate in a stressful moment? Easy. Just think of the Bee Gees. The beat of staying alive is right in that 100 to 120 per minute sweet spot. Hum it in your head, and you'll keep the perfect pace. It's a fantastic tip, especially for your practical exam.
But hold on, what if your breathing check had a different outcome? What if the person is unconscious, but definitely breathing? In that case, CPR is not what we do. Instead, we turn to our other life-saving technique, the recovery position. If they're breathing, your job is to protect them and their airway while you wait for help. The recovery position is designed to do just that. It ensures their tongue doesn't block their throat, and if they vomit, it will drain out of their mouth instead of going into their lungs.
The process is really simple. Position the arm closest to you up at a right angle. Bring their other hand up to their cheek. Bend their far knee. Then, using that knee as a lever, you just gently roll them towards you. And the final touch is to adjust their head to keep that airway nice and clear.
So there you have it, the complete action plan. From check, call, care to the two critical pathways, CPR and the recovery position. You've seen the steps, you understand the reasons behind them, now you have the knowledge to act. The only question left is, are you ready?